Hello, I'm Dr. Hansen, and I am a board-certified chiropractic neurologist. I've been in practice for 14 years. There's only about 471 board-certified chiropractic neurologists trained in the world. So there's only about 10 in the Washington state, and really I don't know any that are really specializing in ADHD and ADD and autistic spectrum disorders, and also dyslexic disorders. I'm going to focus primarily on ADHD and Asperger syndrome, ADD, and autism, that particular spectrum on this particular website. I wanted to just let you know that there is hope. A lot of kids, have been treating these situations for many years now, and many people have come in, many of these children have come in, and adults even, but most are children, of course, that have come in and their grades are really low, their reading level is very low, they're acting out in class, they're not able to focus on a particular item or topic long at all, and they get distracted extremely easy. They usually end up in the class, in timeout in the classroom, or timeout at the principal's office, or timeout at home. It can really wear the parents down, wear the parents out. I understand, I empathize, because I've had many patients come in where they've started out and their lives are, what's going on with my child, and turns into, after we do the recovery program that we do in our office, turns into, I can't believe this is the same child. I can't believe it. Because he's so much different. His grades are better, he's focusing better, he can read better, he balances better, he's coordinated, he's not acting out in class, his teacher's saying, what are you doing differently? So it's very effective. And some of the protocols that we use are through Dr. Melillo. You can look that up. He has a book out that is called, he's a colleague of mine and also a fellow diplomate in applied chiropractic neurology, and he's also board certified. He's written a book, Disconnected Kids. Again, Disconnected Kids, and we use a lot of the protocols in that book because it's the same training. He's just written a book about it. I just wanted to let you know that, kind of give you a brief understanding of what happens with these kind of situations. You've got a situation with ADD, ADHD. Let's break those down a little bit more detail. The ADD is attention deficit disorder. That's more of a distractibility type situation where a child is getting distracted easily. They're not necessarily acting out in emotional outbursts, but they're getting distracted extremely easy. Their grades fail, or their grades are not good because they're not able to stay focused on a particular topic. They need extra help in school typically. They just jump from topic to topic to topic, and they're not able to stay on task, really. And that's really important because your frontal lobe, right here, basically the lateral, it's called the posterior lateral prefrontal cortex, which is basically this part of your forehead, on the side of your forehead, kind of. That particular area is responsible for timing, keeping a person from getting distracted. They've done studies where if that area is not working well, a person will be very, very distracted. So that's the area that we focus in on when we do our brain-based therapies and very specific treatment protocols. We use tools that activate that particular area of the brain. And that particular area of the brain needs to be activated in order for it to inhibit impulses. If you have impulses coming up, we all have impulses that rise to our consciousness. And when those impulses aren't being inhibited properly, then we have a situation where a person is distracted. And we have to do what we need to do to activate that area to get that inhibition against impulses taking place again. So that's basic, real basic, and I have a full-length DVD that you could order that would give you more information on that. Let's go to ADHD. ADHD, and just keep in mind, if this is describing your son or your daughter or you or anybody that you know, then they should come in and get checked because we do very, very specific protocols to get this kind of treatment fixed. But just as I'm talking about these signs and behavioral situations, see if it fits in with what's going on with you or your child or whoever it is that you're watching this video for. ADD is what we just talked about. ADHD is more of a frontal lobe. It's right behind the eye. It's typically behind the frontal eye fields, which is more central, more medial, or more in the center of the brain, center of the forehead. That particular area of the brain fires down to the limbic system, and the limbic system is your emotional center, and it inhibits it. If you're not getting that active inhibition of the limbic system, then emotional outbursts will take place really easily, and it's hard for them to. It's hard for a person if their frontal lobe is not working properly. It's hard, very hard, and almost impossible in many cases to inhibit those impulses that come up. So that's the acting out. That's the outbursts and emotional outbursts, the temper tantrums, the yelling, the screaming, the whine, and the ongoing whining that may take place, the nagging, that kind of stuff. That is more of a prefrontal typically right-sided brain, frontal cortex in the center of more behind the eyeball on the right side. That's something that we do. We do very specific treatment protocols for that, and they differ from the ADD. Some of them are similar, but they differ in specificity when we're dealing with that. Autistic is real similar. It's just more severe down the spectrum. It's also typically a right frontal lobe issue. And Asperger's is not quite as bad as autistic as far as functionally deficit. The difference in brain balance of the frontal lobe is much lower, much greater. The difference is much greater. The imbalance is much greater with an autistic versus Asperger's versus ADD, ADHD type thing. So we deal with all of those, and because it's really, it's real functionally, it's very similar in nature as far as the ultimate cause of the problem. And the research proves that. There's tons of research out now talking about the different aspects of frontal lobe, right frontal lobe in particular, that is the kind of the breakdown point on these children in the autistic spectrum: Asperger's, ADD, ADHD, and autistic issues. PDD also fits into that. PDD, NOS. If your son's been diagnosed or daughter's been diagnosed with that, that's really important too. Some of the symptoms, I just wanted to reiterate a few other things. Reading comprehension, math problems, reading comprehension. Sometimes these children are quick as a whip when it comes to math, facts, and all that kind of stuff. But basically left brain activities that you think of, things that you think of as left brain, like math, facts, the act of reading, but not necessarily comprehending what they're reading. That's where the breakdown occurs. That's typically a right frontal lobe issue. That controls the comprehension and kind of the understanding the big picture, the understanding the concepts, understanding the why versus the what. And it's very tied into the emotions. So that's kind of a basic understanding of what's going on. I have more of a full-length DVD that you could order if you would like. I would recommend, though, if you have a son or a daughter that's been diagnosed with ADD, ADHD, PDD, NOS, Asperger's, autism, I would recommend that you have them come into my office and do a consultation. You can come in, you can do a free consultation, and then I'll be able to get a look at your son or daughter or whoever this information would be for, and then I can get a better idea as to what we can do to help them, how severe it is, what we're looking at as far as realistic expectations. And then come in and we can check it out. And what you would need to do for that is just on this website you have information where you can fill in your name, your address, your email, and your phone number. And please do that and fill out all the information in the box on this page. And then we'll give you a call and set up a time to come in and have a consultation. Again, there's no charge, so you have nothing to lose except for an hour or so of your time, and it could change your entire life, your child's life, and it could change your life if you have a child whose grades are suffering, or you're really concerned that they're going to grow up and never really excel in life, because that's worth so much. It's worth so much, and I just have a passion for this because I've seen children's lives change so much with the treatment that we've given them, and it's just wonderful. It's absolutely wonderful to see that. So again, fill out your information. give us a call if you'd like to come in, 425-558-1266. Again, 425-558-1266. Get that in the contact information on the site. Leave your information, and we'll send you out a DVD. Either way, we'll send you out a DVD where you can get the full-length, kind of more longer version of what it is that I'm talking about with our treatment protocols and what's going on. We'll see what we can do to help you. All right? Take care. Have an excellent day.